Assalamu alaikum warahmatullahi wabarakatuh. This study was published in Journal of Endodontics in 2022, done by Tao Qu et al. This study was talking about prognosis of second molars with external root resorption caused by adjacent embedded third molar. So, external root resorption in permanent teeth refers to cementum and dentine defects on the root surface. Many factors such as chronic periodontitis, pressure from the impacted tooth, tumor, trauma, and orthodontic treatment might induce external root resorptions by activation of odontoclast and cementoclast. So, this prospective study was designed to determine the prognosis of second molars with external root resorption caused by embedded third molars following embedded third molars removal and explore related predictor. So 63 teeth from 58 patients were included in this study from West Shine Hospital. The inclusion criteria were asymptomatic second molars with apical external root resorption caused by embedded third molar, functional external root resorption of second molars with normal bulb, second molars with apical external root resorption without stage 3 or 4 periodontitis, root fracture or tooth defect or deep caries, bulbitis or apical periodontitis. So patients were excluded if they had local lesion such as pericornitis and hemangioma, systemic disease that contraindicated tooth extraction, and if second molars with apical external root resorption was combined with adjacent cyst, tumor, fractures, and osteomyelitis diagnosed by medical history and the clinical and radiographical examination. So second molars with apical external root resorption were classified according to the adjacent embedded third molar position, maxillary or mandibular, and the type and the degree of external root resorption. So let's take a look on the figure 1. The type of external root resorption was classified as being either fully affected, indicated that all roots were affected, or partially affected, indicated that one or more complete apical foramina remain unaffected. The degree of external root resorption was graded as mild, moderate, or severe. Mild, that mean apical third of the root limited to apical third of the root, moderate extending from the apical to middle third of the root, and the severe extending from the apical to cervical third of the root. All surgical were performed under infraalveolar nerve block, and the suture were removed from 1 week after surgery. So, like what you see in these pictures. We can see here from A, it is pre-operation, B incision, and then flap, and dividing the tooth, and divided the crown also, remove the crown in the F, and then remove the roots in the G. Finally, they do suturing and removal after 1 week. So, regarding to follow-up and examination were performed immediately before embedded third molars extraction and 7 days, 1 month, and 6 months post-operatively. Potential predictors like sex, age, number of the roots, embedded third molars extraction, position, type, and the degree of external root resorption of prognosis were analyzed by univariable and multivariable analysis. So, moving to the result, a total of 63 external root resorption of secondary molars from 58 patients were evaluated. 56, that means 89%, remain asymptomatic and normal response to heat and the cold tests according to univariable analysis. We can see also on table 3 multivariable analysis, older age and the type of all roots affected were significantly associated with poor prognosis. So, in total of 6 teeth were identified as a failure among cases determined as failure. More patients were over 30 years old, 5 out of 6, and with BA type of external root resorption when complete apical foramina remain unaffected, 4 out of the 6. Mild resorption was observed in 4 cases, and the moderate resorption and severe resorption were reported in 1 patient each. 4 external root resorption were extracted and 1 tooth received root canal treatment. So, in conclusion, we can say second molars with external root resorption caused by embedded third molars mostly remain a vital bulb after third molar extraction without further intervention. Older age and the presence of all root affected were risk factors for a poor prognosis.